So the recording should just be starting. So thank you for joining today's session, which is all about our NHFT Recovery College and also our peer support service. So without there's anything much else I need to say, other than if you have the chat function, please do use that to ask questions. We'll possibly take questions probably near the end of the presentation, but the chat function is there. If you don't have the chat function, hopefully you've got the ability to raise your hand option instead, so we can ask questions in the session. But I will hand over to Matthew. I think you're starting, aren't you, with your presentation?
Yeah, good afternoon, everybody. So I'm just going to share the presentation, and then myself, Pete and Sarah are going to present you on our services. Just bear with. Hopefully you can see that okay. Yeah, it's at this point that I can't see you very well. So if anybody's hand does go up or anything goes in the chat that is it's better to discuss then and there, then please let us know. Yeah, so hello everybody. Thanks for coming along to this short session, just talking about the Recovery College NHFT and peer support worker services. What we're about really, and how you can get involved or support our services. So I'll just start by introducing myself. My name's Matt Carter. I'm the operational manager for Recovery College NHFT. I'm an occupational therapist by background, though I'm in this managerial position at the moment, and I've worked for NHFT in adult mental health services, both inpatient and community services, for about 18 years. And I just think something like the Recovery College and the way it utilises the true value and true worth of lived experience of people and their service users and their carers and family really sort of resonates with me on a personal and professional level. So that's my motivation for being involved. I'm just going to hand you over to my colleague Sarah. Sarah, do you want to introduce yourself?
Yeah, thanks, Matt. Hi, everybody. So I'm Sarah Ferris. I'm a currently senior peer support worker, but previous to that, I was a carer peer support worker. Like Matt, peer support resonates with me because I came into this role because of my eldest daughter. So 10 years ago, she was incredibly poorly, and there wasn't people like me, or there wasn't the Recovery College, there wasn't the peer support out there. And I just think there should be. There really should be. We've grown from strength to strength with what we do in the Recovery College and with peer support. And yeah, that's why I do what I do.
Thank you, Sarah. And a big thanks to Sarah, who stepped in at the last minute to cover a colleague who's off sick. So it's very much appreciated. And without you, we wouldn't have been able to go ahead today. So thank you very much. And I'll just also ask my other colleague, Pete, to introduce yourself. Pete, please.
Yeah, hi everybody. I'm Pete Middleton. I'm living with young onset dementia. I was diagnosed 5 years ago. So I'm a customer. I'm a service user. I'm also actively involved with Recovery College as one of the many pies in which I have my fingers as a person with lived experience now. And I'm here to, if I can, let some of my enthusiasm rub off on you.
You absolutely can. Thanks a lot, Pete, and thanks for joining us. So I'm just going to hand you over to Sarah now, who's going to introduce our first slide and then say a bit about the peer support worker service. So over to you, Sarah.
Thank you, Matt. So I'll just give you a heads up and I want the next slide on. Is that okay, Matt?
Yeah, that's great.
Perfect. So we can start with our first slide, which is our power pots and plant pots, and explains what is recovery. Recovery is a journey. It's the fundamental sort of where we start off with peer support. Because when we're talking about recovery, we're not talking about the end of a collection of symptoms. It's a continuous journey. It's ever moving. It's fluid. What we do is we look at how we can support people to live a satisfied and meaningful life, even if they are living with a long-term condition or supporting somebody that is. You might hear the words recovery journey, and you'll hear that often. We use it all the time within peer support because that's exactly what it is. It's a journey rather than an end and an end and a finish. It's a process of change that looks different to everybody. And when we use the phrase recovery journey, we're using it as an umbrella term to cover mental health and long-term conditions that people may not specifically recover from. And there may be things that people are going to have for the rest of their life. They may be new, they may be born with that way, but it's constant, it's there. And that's why we understand the word recovery as being an ongoing process. It encapsulates informed choices about health and well-being, being empowered to make choices to give an individual hope and opportunity to live their life that they wish to lead. Each individual will have a different idea of what recovery looks like. Some people like to talk about being recovered from a certain period in their life, but they will move on to the next period. It's ongoing. It might change from day to day depending on how the person is feeling and what their needs are at that time. Peer support can draw on, a peer support worker draws on their own lived experience to work with someone and support them to work out what recovery looks like. So we use our own lived experience when supporting carers or supporting service users, and we draw on that, what's helped us, what's been good for us, what's worked with us. We never push those things onto somebody. We work with the person we're supporting to give examples and offer hope and what individual goals are, what they wish to achieve and what they are hoping for within their journey. So looking at the plant pots, the Recovery College and peer support see recovery as a process of growth. And we've used the plant plots. I keep calling them either flower pots or plant pots. It's not easy to say plant pots when you say it a few times. So the first one is empowering somebody to make their own choices, make their own decisions and decide what they want. Working alongside somebody and walking that path with somebody doesn't mean you take the responsibility as a peer support worker. You are empowering the person that you are supporting. And it's important that we remember that as peer support workers. It's a process of continuing change, and it's a life beyond illness. We look at person as a whole and we allow people to reach their full potential. That's what we are there for as peer support workers, to work with somebody to achieve all of those things that are on our plant pots. And the Recovery College and peer support have been created to facilitate and work together with people. Next slide, please, Matt. So looking at peer support within NHFT. Next slide, please, Matt. Support is people drawn on their own experiences to support others along their recovery journey. And that's what we've just said, and that's what peer support is. It's offering hope and empowerment to others to find and reach their own goals. Peer support can be formal or informal. And if we look at informal peer support, it's something that often happens naturally when people have similar experiences and they come together to find hope, empathy and shared understanding. And it can happen on an everyday interaction with friends and family, as well as hospital wards and day centres. Peer support is what we use as a term, but it can be a buddying system. I know Age UK have a befriending system. It's all the same type of thing. It's peer support. The more formal peer support setting is when somebody's trained as a peer support worker and they use this training along with their own lived experience to intentionally offer that hope and insight to understanding of others. I'll talk a little bit more about the training when we move further on. Next slide, please, Matt. So peer support within NHFT is one role that was identified with the government and their long-term plan for improving mental health services. Funding was made available by NHSE, which allowed us to start the peer support workers in their training. And we have worked closely with IMROC to develop the service. I myself am an IMROC trainer and I deliver the training to peer support workers for NHFT. I did my training through IMROC, but we decided that it would be a good idea to deliver our own training through NHFT, so we could gear it more to NHFT, kind of have a feel of what it was like to be a peer support worker specifically in our service. Carer peer support is something that has been found to be incredibly beneficial. There are many more peer support workers than there are carer peer support workers, but they both are incredibly valuable. Carers themselves know that because the people they are supporting, carers seem to go unrecognised, as we all know. So offering that lived experience from a carer peer support worker, we've found to be invaluable. I know I did when I was working as a carer peer support worker. And in ALMS, they've been collecting data which suggests that service users who carers access peer support are less likely to reattend A&E for their own mental health. And as you may know, NHFT are delivering a carer strategy to improve support for carers, and they have workshops, and it was identified as being an essential part of provision for carers. There's Carers Corner as well. There's many different areas in which carer peer support workers are involved within NHFT. Next slide, please, Matt. So where are peer support workers based? These are just some of the areas that our peer support workers are working in. We've additionally started this year, and then at the end of last year, we've got peer support workers now working in the gender clinic and also working in the eating disorders team. Children and young people is another service in which there are both carer peer support workers and service user peer support workers. At the last count, I think there are 38 peer support workers in total. We have 6 more starting this year, and many more going through training. As we speak, I'm currently delivering training to a cohort of peer support workers through IMROC. Next slide, please, Matt. So what are the benefits to the person who is being supported by a peer support worker? As we said, it inspires hope, the hope that you can recover and better days are to come. Having been personally in a situation as a carer supporting my daughter, that is one of the things I have found when I have gone out as a carer peer support worker is crucial to offering that light in the darkness that people think when they're in the worst moments that it's never going to get better. As a peer support worker, you are evidence that it does and that it can, and you can guide people to those better days. It reduces isolation because as a peer support worker, you might be the only person the person you are supporting sees, and it breaks that isolation, and it's a great stepping stone as well for people struggling with the loneliness. You as a peer support worker can almost act as that bridge for people getting back into community and supporting people with that. I've often gone to groups with the people I support and being that first step, that link back into community setting. It improves self-esteem. It offers a sense of belonging and recovery to the person that you're supporting. It makes the people you're supporting, whether that be carers or service users, feel more comfortable with professionals and more able to engage. We act as advocates. Peer support workers can be there and they can kind of decipher that medical language and answer those questions that are sometimes tricky to understand when using the clinical jargon. We can also ask the questions that somebody you're supporting may feel less able to do so, and therefore encourages connections and fosters that sense of belonging, as we've spoke about previously. We provide emotional support and improve experience for carers. And as I've said previously, it reduces service use, being that link to somebody. Research has shown that when peer support workers are involved, somebody else's care, there's fewer patient days. Next slide, please, Matt. So what are the benefits for a peer support worker? It's that increased feeling of empowerment. You feel progression and increased control in your life. specifically for service users who are ongoing in their journey as well, they may feel a benefit from supporting somebody else. So it helps them to feel valued and less stigmatized. It helps somebody develop a sense of worth. The employment opportunities, obviously within NHFT for other care providers as well. So a service user may have felt a stigma of joining a particular service because they've had mental health struggles themselves. They may feel that it's difficult getting back out there and back into work. Peer support offers that, and working with the Recovery College helps to offer that sense of training and that belonging. There's a benefit for the team as well. Having a peer support worker working in your team opens up so many different avenues. I know when I worked for NSTEP, that was where I was a carer peer support worker, which is a provision for early intervention for psychosis. Having somebody on the team helps support the occupational therapists, the CPNs, the consultant. It gives an insight from two different angles. It gives an insight into the person that you're supporting, and also it helps to give an insight when I talked about my experiences and my understanding of being on the other side. A lot of mental health professionals don't have that understanding of what it's like to be in a mental health situation. Next slide, please, Matt. I Want Great Care. These are just a couple of the feedback that we've had from people that have been supported by peer support workers, both from family members, speaking about carer peer support and service user peer support. I can't tell you how much people value peer support. You know, the feedback that you get, there's only 2 on there at the moment, but there's so many different feedback that we get from people who have their lives are being enriched with peer support workers being involved. Last slide, please, Matt, from me. So how do I get involved in peer support? There's many different ways to do it. Our peer support workers are now working together with the Recovery College as so they're delivering training. So they work as trainers. You can sign up for an IMROC peer support training, and you can do that either with IMROC directly, or you can do it through NHFT. Like I said, working with NHFT, delivering the training gives a different kind of perspective. It's possible to apply for a peer support role without already being trained. You can do it 2 ways. You can do the training and then decide whether you want to go forward and use your peer support IMROC training to further your career, or some people just find it's good knowledge to have. In the situation, once you've been trained, it's up to you to decide what you do at the end of it. You can apply for jobs whilst you're training, before your training, or after your training. IMROC provides the training. We take on a license to deliver that training. They're a not-for-profit organisation. They have extensive knowledge and they deliver the training, I believe, as far and wide as places like Singapore and in America as well. The IMROC have worked closely with Health Education England on the development of the peer support training. And as well, it's ongoing in how they change and how they learn. They've recently updated many of the information and the slides and the training that they do to be more heavily involved in carer peer support workers. Who can apply for the training? Anybody with lived experience, anybody who's a carer can apply to do the training. The training doesn't necessarily lead directly into employment. However, what we offer now when you do the training through NHFT is we offer placement experiences. So you can be linked up with a peer support worker who is in post, and you can gain an understanding of what it is that peer support workers do. How do I apply? You can apply by completing an expression of interest form. That is through NHFT website, through the Recovery College, or through a PSW coordinator. And the last few words from me is just to explain the recruitment is a process. You apply and you will gain more information through an informal group interview, which is online. Very, very informal. It just asks you kind of what your knowledge is, what you would like to do, what you hope to achieve. It's in a group setting, and we do it that way because that is how the training is delivered. I think that's about it, Matt. Have I missed anything out? Is there anything you'd like to add? A whistle-stop tour of peer support there.
No, absolutely. That's great. Thank you very much. I mean, Sarah, are you happy if we sort of wait to the end, and then if there's questions for like both services, we can answer them together? Is that all right?
Absolutely. Yeah, perfect.
Brilliant. Thank you very much. And again, thank you so much for coming in at the last minute.
No, you're welcome.
That. Right. So that's smashing. So that leads into myself and Pete talking about the Recovery College. And I should imagine as we go through these slides, you'll see a lot of similarities and overlap between our services. Like Sarah was saying, we often work closely with peer support workers. We have peer support workers who are advocates or champions for the Recovery College. So they might be the person that helps people sign up to become a student, supports them to attend courses. And we have had some really great examples of peer support workers actually coming along both as students with the person they're supporting and attending courses together. But also as trainers, using their lived experience in Recovery College courses. And you'll see how important that is as we go through the presentation. So yes, let's talk a bit more about the Recovery College. Please, Pete, as we go through, if you feel there's anything from your experience and knowledge that you want to chip in, please do so. Otherwise, we'll just work through as we'd agreed. But yeah, chip in as much as you wish to.
By all means.
Thank you. I'll just start then. So what is the Recovery College? So Recovery College and NHFT, there are, I think, 80 plus recovery colleges up and down the land. As Sarah mentioned, all the Recovery College courses also get that consultation advice in setting up from IMROC, which is Implementing Recovery through Organisational Change. So there's as an umbrella service, they have an influence over all these services that have lived experience at the core. We've been established over 5 years. We're county-wide across Northamptonshire. We provide free to access educational courses that are predominantly around mental health, well-being and neurodiversity. We'll go through some of our courses later on. These courses are delivered mostly face-to-face because in a face-to-face situation, it's much, much richer. It's much, much better for students to be sat alongside their peers to engage and provide that support for one another. We also provide them online and we have some e-learning courses as well. We, like many services, went online a lot during COVID, but we're now coming back face to face because that's where our true worth is. We've got over 2,000 registered students with ourselves. Obviously, they're not all active, but a lot of people are on our communications in terms of our newsletter and general comms about what courses are available, what's happening close to them. We've got over 30 courses running each term. And yeah, we're here to support people who've got mental health conditions or other conditions to become experts in their own self-care. We're here to help families, friends, carers and staff to better understand support services and to support service users and their families in their recovery journeys. And as Sarah said, that takes many forms and the timescale for that is unique for everybody. Okay, so Pete and I are just going to talk a little bit about the principles of the Recovery College. So to start with then, our Recovery College, we have the Recovery College principles of hope, control and opportunity throughout everything we do. It's about hope that students can see a future for themselves, that they can believe that the challenges they're currently facing can improve. that challenges for their loved ones, the people they care about, can improve, their friends, and that life will get better. And as Pete will testify later on, a lot of that comes not from hearing from staff, but from hearing from other people in that situation. Just like Sarah said with peer support workers, it's about people who have lived it, people who are on their own recovery journeys, but at different stages, and feeling at a place of resilience and strength where they can share and benefit others. We have control throughout everything we do. It's about knowledge is power, sharing information, empowering individuals, standing shoulder to shoulder with one another, to give back, control and information and knowledge, and to empower people to take control of difficult situations and know more about themselves and know more about how to keep themselves well, and about opportunity, what's happening available for them locally, nationally, that they can be involved in. How can they access support? How can they support themselves? What's out there? What other courses can this course lead into? So hope, control and opportunity are absolutely fundamental to everything we do. Pete, do you want to say a bit about co-production?
Yeah, sure. I'd also like to mention, I guess, that hope, control and opportunity, all three of those things are vital ingredients that go towards, for instance, just getting a group of peers together, networking in a room is fantastic for the hope element of those three pillars. So that classroom environment, getting people in there who are very often lonely and isolated, just knowing that there are other people out there, is just a wonderful thing. And of course, co-production is just, for me, just scratches the surface of what we do, because we co-create too. It's not just the production and the end product. We're there from the very beginning, working together as equals, as peers, professionals, healthcare professionals, and people who are experts by experience in the multitude of different ways that, of course, that we are. And we feed from each other, we learn from each other. It's a symbiotic relationship, and out of it comes a course that I believe will be much better suited to achieve the desired end results because of its co-production than it ever could be if it was produced in isolation, either by a healthcare professional or by someone with lived experience. So the co-production element, it really is what makes Recovery College. Without it, it will be just another set of courses.
Thank you, Pete. Yeah, Pete's absolutely right. We practice what we preach, and if you're developing a course with us, you'd have an expert peer trainer, so somebody who's got lived experience either as a service user or first-hand experience or as a carer, working alongside a practitioner trainer, so somebody that's got a qualification or experience of working in that area, and they work shoulder to shoulder, side by side, from the very start of a course right through to its pilot and its delivery. And it's not about one person leading and the other person following. It's about both of them leading. And yeah, we've had some amazing relationships build with people. Pete's got examples of his own. I'm currently developing a course with somebody, and it's fantastic learning experience for both of us. So yeah, it's co-production is at our heart. And that yin yang diagram that we've just put up, it's about our courses work best of all when the mixture in the room is that balance between those people that access our services and those people that are involved in providing our services. So we don't want it to be too much in favour of service providers, because that becomes a little bit unfair on carers, service users and former service users. We want to have a really, really good representation of those people that access our services. And when you get that, and you get that passion and that co-production thing in the delivery of the courses, that's truly when the magic happens, and when people really, really find it beneficial, really go away finding that this was something really positive, at that point of their recovery journey. So let's go on to this one. So Pete, who are we here for? Who are our students?
Well, goodness me, what a broad spectrum that covers. As you can see there, you know, if you're over 18, if you're a current service user, or you're part of the family of a current service user, or you've been a service user within 12 months, you know, all your staff, it's just more or less, it's really easier for me to tell you who isn't, who Recovery College isn't there for. And I've never known anybody to be turned away so far, because the criteria more or less encompasses most people, and that rightly so, I believe. I don't really know this, what else to say about it. If you've heard of Recovery College, I'd say you're very probably find that Recovery College is there for you.
That's absolutely right, Pete. Yeah, absolutely right. We're here for everybody of Northamptonshire who accesses NHFT services or services of our partner organisations. So that can be Northamptonshire carers. So we have some e-learning courses with Northamptonshire carers. So then everybody that works for Northamptonshire carers or accesses Northamptonshire carers services, which are many, can enrol as a student with us. Everybody enrolls for free, and everybody, all students are equal. So once if you're sat in our classroom situation, Pete, we ask staff members to take their lanyards off and their badges off. And we also ask people just to write their name on a sticker and put it on their chest, just so people know who they are. But it doesn't matter if you're Angela Hillary or you know, a carer who's just moved into the county and using our services. You're all equal. You're all the same. And I think everybody really values that. I had a staff member come up to me yesterday and said, I'm interested in this course. Can I come along to it just for me? And I said, absolutely, of course you can. It's for you as yourself, as a staff member who supports others, but also how you keep yourself well and look after yourself. So it's very much both of those things. In fact, we're quite flexible, aren't we, Pete, on our criteria, really, if it's going to be beneficial for folk. Just got to be over 18.
Yes, very much so. And I believe that's the way it should be. And that's another thing about Recovery College that I like. That accessibility is worth its weight in gold.
Absolutely. Right, let's carry on. Thank you, Pete. So just a bit of research that backs up in a lot of ways what Sarah has said before about the benefits of peer support work. They're actually very, very similar to the benefits that research into Recovery College has shown. So we're just a little bit more about us. We're a non-clinical service. So anybody that gets involved with us, we do not have access to their clinical records. Yes, we have a duty of care to them, as any service does, and a responsibility if they find themselves in a situation where they need additional support or they're at risk. Yes, we'll link them in with their service they're working with or some of our crisis services, but we don't look at anybody's clinical record. And I think that's actually fantastic from my point of view, as an ex-clinician, because it means that my relationship with the students is completely different, and it makes it a lot easier. We follow the term times, the summer, autumn, spring term times of us, like a school does, and have courses during those term times. But we're here to complement our clinical colleagues and our clinical services, which we know are under a huge demand at the moment. You know, so if you've got somebody that's waiting on an appointment or between treatments or between appointments, they can come along to the Recovery College. They can come along and hopefully find a course that's suitable for them. You know, and they can access that alongside the treatment they're getting. They can access that after they've been discharged from services. So we're really here to work alongside, and it's really those people that come along to us find that massively beneficial. So a bit about the research. There's some national research that's gone on, quite widespread. The references are there. But students who attend Recovery College courses, they report that they've had both an increased knowledge and skills, so increased learning and empowerment for themselves, but also improved self-esteem and improved well-being and an improved quality of life. So they're really, really powerful things. They're powerful things that the NHFT is actually focusing a lot on actually trying to measure at the moment. So things like the ReQual quality of life measure is actually being used by some services, and we know that recovery colleges actually deliver on that. But alongside that, services report as well great benefits. They report greater workforce satisfaction. So greater satisfaction from members of that team that actually attend the recovery college themselves as a student. For members of that team that attend the recovery college supporting other people as well, it improves their greater workforce satisfaction. There's also an improvement in people having those people that are involved in a recovery college but also need inpatient admissions. Their evidence shows that their inpatient stays are greatly reduced and they have less contact with community services. So what they find is the expert in-depth support that clinical services get, sometimes people can find that they get what they need from that lesser support and that peer type support that you get from attending recovery college courses. And with that in mind, that leads to improved cost effectiveness as well. So massive improvements. We've had people, and Pete's going to say a bit about Pete's that individual journey, but people that have started with us as students, then come along and shown an interest in being a trainer. And in one case, we've actually got somebody that's actually a full-time member of staff now. And it's absolutely fantastic. It has their own lived experience, but it's an absolute fundamental part of our team and of NHFT. Okay. Right, Pete, over to you, sir.
Yeah, God, that's a frightening slide, isn't it? Let me just remind you of Matt's diagram of the yin yang of service providers and service users. Well, this is me. I'm a typical service user, I guess. As I said earlier on, diagnosed with young onset dementia 5 years ago now, so I'm well down the road, and it can be a lonely one. But I discovered Recovery College quite early on my journey, and being able to be a part of delivering some of the services for me is quite wonderful. And the confidence that it's given me, this illustrates that I'm a public speaker now. I was lucky enough to be named a coronation champion last May in the King's coronation list. I blog. That's me doing a bit of clowning there. One of the courses that I co-produced and co-present until recently, this one, because sadly the lady I co-present with, well, very luckily for her, she moved on with promotion. So now I'm looking for another clown. So please, if you want to put yourselves forward, you'll be most welcome. I know what it's like to live now with this it's not a burden, but the knowledge of your own mortality, and it can be lonely, it can be daunting, it can be frightening, it can be all of those things. But I find that the more you mix with other people in the same boat, the more you see that actually it's not the end of the world. Like any illness, it's got its funny side. It's got its it can be good. You know, they say you can't live well with dementia or a life-limiting illness, but yes, you can. We all have off days, but yes, you can. And they also say laughter is the best medicine, and it is. It jolly well is, clinically proven. So for me, one of the things I enjoy most is showing people how they can gently laugh at themselves and gently make the best of a bad situation. And it's something that you can teach people, and you can show people, and showing them is a delight. I'm currently helping to write a course we'll present later on in the year called Bright Sparks, which is about we're going to do a comedy workshop, a series of workshops in which people will network and produce comedy writing. We'll critique comedy and humor, We'll write limericks between ourselves, which can be a bit risky, but also great fun. And maybe, who knows, at the end of it, produce some sort of performance. But the object of it is just to be joyous, just to have fun, and that will, of course, we hope, once again, address those 3 pillars. It will inspire hope, because we'll give people self-confidence and self-esteem. We'll help to nurture that. Control, you know, writing a little bit of comedy, working with other people to produce something to gain that self-esteem, empowers you, and it lets you recognize the fact that, you know, just a diagnosis of an illness doesn't put a label over you, around your neck, that says useless and worthless, because you still got all the skills, those life skills that you've always had. But the trouble is, they get a bit rusty. So using them again is a wonderful thing. It's great for you. It's great for your self-esteem. Opportunity. People can create their own opportunity out of a course like this. They're, you know, because the skills that they get, they can put to use in many different ways in their lives. And, you know, it stops people letting them take their lives too seriously all the time. There's a place for comedy. You've got to be very careful how you use it, and there's a place for being serious. But it's just about heart, and I love it. I love the process of producing it. I love that interaction. I love the process of presenting it. To see the light bulbs go on sometimes over people's heads, to watch them talking to each other during the courses, to watch people who are a little bit worried and wary about being with other people, strangers that they've never met before, to watch them mature. And after a week or two, to see them, you know, they're going for a coffee outside the courses sometimes. They're relaxed. It's first name terms. They don't feel isolated anymore. It's just, that alone is just joyous. You know, people aren't going to get a qualification out of any of the courses I produce, but what they will get is a lot of life affirmation, and that's very important to me. So I guess that's the person I am, and it's taught me now that it's how good it is. It's reminded me how good it is to be part of a team, a true team of people working together. It's allowing me to do what I want to do. I have a passion that I want to get my message across to people, that it's not the end of the world to get a diagnosis of an illness. It's just not. And I'm, wow, I can do that now. I can encourage people. You know, it's given me a purpose. And the more I do it, the more I see other aspects now that I want to think about developing courses in, not just with me, alongside carers, such an important part of anyone's illness and their journey, you know, working together with them. So I better shut up now, but I hope you can see that I actually believe this at the bottom of my heart. You know, I'm not indoctrinated. I just see the worth of it. So thank you.
Thank you, Pete. And other people do, and we hear amazing feedback from the courses that you help deliver. So just going to share a bit about feedback now. We won't go through it all, but yeah, you know, don't just take Pete's word for it. We get amazing feedback, as do our peer support work colleagues, on the importance and value that people get from what they do, what they have access to. And there's a couple of quotes in there, Pete, that I added in about the from the dementia, the recovery in mild dementia and mild cognitive impairment, that I'd just like to share. And one of those is, before coming to the course, I blamed myself for having dementia, and now I don't. And I think that is so powerful. And that's feedback on a course that Pete has co-produced and been fundamental in delivering. And the other one is about sharing experiences and not feeling alone in caring for somebody. So sometimes, as Sarah said, that carer role is just all consuming and takes up all your time. And sometimes to know that there's other people out there and that you can provide these bonds and support one another. It's huge. It's huge. Okay. Anything you want to add to that, Pete, in terms of the feedback?
I've seen, you know, I've seen so much feedback, but behind every one of those bubbles is a big story, you know. When somebody bothers to even fill out a feedback form, when all you want to do at the end of a course often is to clear off, isn't it? So so if there's a couple of boxes, you tick them, but you leave the rest back. You say, yeah, okay, excellent. People take the time to write feedback because they're moved, because they're touched by what has occurred to them during that course, that session. And so it's meaningful. All of this feedback is meaningful.
Absolutely. Thanks, Pete. So let's go on. So this is our these are our courses that are running over the spring term. Some of them are running more than once. So we've got over 30 courses running this term. So that's from January right through to up to Easter. So you can, if you can have a look at those, you can just see that they're quite varied. I don't actually think that's all of them. I was looking. Your course isn't on there, Pete. I do apologise about the recovery and wellbeing in dementia.
But hopefully, people who are looking at this, it will also spark their imagination to say, you know, this is the beauty of a recovery college. Can you think of a course that's missing there that you'd like to see? Well, come on, let's get together and let's write it. Let's do it. You know, the possibilities are remarkable.
Absolutely. And if it can be true to the themes of recovery and hope, return, opportunity, then there's a course in there, honestly. So there, yeah, and we've got some e-learning courses too, around loneliness, caring. So these are ones that have been produced with Northamptonshire Carers, Introduction to Carers, and Health and Wellbeing, and there's another one that's in production. But yeah, we've got a real variety of courses, and the ideas for them, like Pete said, have all come via co-production as well. So if you ask me whether the Recovery College needed a course on clowning, I'd say I don't think so, because I know nothing about the therapeutic benefit of clowning. But then when people come along with passion and knowledge and share that, then all of a sudden you can see its true value. So there we go. So I'm just going to go on to the next slide, Pete, because as if by magic, it says about the Humour for Recovery course that you mentioned that you're going to be involved in and developing with Bright Sparks. So hopefully when this goes out for people that are reviewing back later, they'll be able to see that the dates, we've got 6 different dates happening sort of week apart. And yeah, the challenge is really that people need to commit to all 6. And that's a bit different to our usual Recovery College courses, which are usually one-offs of a half day, like 3 to 4 hours, maybe a bit less, or a full day course up to sort of 6-7 hours. So that's how we usually do it. But this is a bit different. So we're always trying new things.
Can I just mention with that I know this works. I attended a couple of the ones that went on last year. That's why I'm looking forward to this one, because the beauty of something like this is you get people come along as couples often. So you'll have a carer and someone living with an illness, and it doesn't stop at the end of each workshop. They'll come back next week and say, you know, when we got home, we were chatting about what went on. There was so much interaction, and then we sat down and we wrote something and we had a good giggle, and we've come along with these ideas this week. So the whole course is not 6 or 7 separate sessions. It's organic. Once you start, you can't stop. And it's a different way of doing things, but it works extremely well because it gets people talking within relationships. And that alone has got a great therapeutic benefit, in my opinion. So it's value added.
Massively. Thank you. So how do you get involved in the Recovery College? Well, to become a student, you need to click on this link or contact us, or go to the website and click in that the NHFT website and click in that pink box that's on the Recovery College page and fill in an enrolment form. It takes about 2 minutes, asks a bit of basic information. and a bit about what you need, support you need as a student, that sort of thing. You then get sent a student number and an access code. The access code is so that we can, when we're booking our courses on Eventbrite, so you have to have an Eventbrite login, and anybody that knows Eventbrite knows that it's a global platform for booking courses. And we've been in a situation before where we've had people join from New Jersey, USA. We've had people drive down to a course from Glasgow on a one-off. So we've had to, not that we turn anybody away, we make sure they get a nice cup of coffee and they can join the course. But it says a bit about us being able to make sure that we're really targeting at the people that we're for, and that's the people of Northamptonshire. So once you got your enrolment student number and access code, yes, you need a Eventbrite login. And then once you've got that, you can click on our Eventbrite page, and it lists all our courses in date order. Now, we know that for some folk, this is, too many steps, too much challenge. So if you've got anybody that you're working with, anybody that you're a carer for, or that you're a friend of that you think could benefit, all they need to do is give us a call and we will support them through this process. Yes, it's great that people can navigate this process themselves, but we totally understand that we're here for people that perhaps need a little bit of extra support, A, to enrol, but B, very much on their recovery journey themselves. So we're here to do that. So yeah, that's it really. All the courses are free. Enrolling, we use Eventbrite because it's free to services that don't charge for their courses. So that helps us sort of have a better return on the NHS pound. And that's it. So any questions around that, please do contact us at the Recovery College. Our contact details are at the end. So what to do next then, just to sort of summarise what Pete and I have been saying. It's really, what do we need from you? We need you to get involved, don't we, Pete?
Yes, please.
And that can be as a promoter or an advocate, so somebody that's a champion, like our peer support worker colleagues often are, somebody that promotes and speaks positively about the Recovery Colleges and answers a few questions, helps people enrol. As a student, come along, start your own Recovery College journey, or as a trainer. There's opportunities out there. We have all sorts of folk involved in our courses. In our co-production course, one of our practitioner trainers is Adam Smith, who's our Director of Mental Health. And I think Adam gets a huge amount out of it as well, because it sort of resonates with what's important to him and the trust about co-production. So yes, it really, lots of people from varying backgrounds can become a trainer and benefit other people. So thank you for listening so much attentively, and thank you for those that take time to listen back to the recording. So yeah, just over to you guys. Have you got any questions for Sarah or Pete or myself? And I shall stop sharing. So thank you, everybody.
See, Joanne's got her hand up.
Yeah, I've just got a question for Sarah. Sarah, can you just, it was great to hear everything and understand. Can I just ask you a specific question? So when you've got somebody who's a trainer working with an individual, how does that happen? Are they, say for example, you've got a younger person over the age of 18, does that person go and support in their own home, or does that person come out of the home into a different setting? How does it work?
So by trainer, you mean peer support worker once somebody's done the training, don't you? And they come along as a peer support worker.
Yeah, they come along as a peer support. Yeah, they're in the system to support people. Yeah.
So it can be done in all sorts of different ways. I mean, it is led by the team that they're working in, and it's quite specific. So if you're working in a hospital setting, you usually see people while they are inpatients. But myself, I worked in the community, and I could see carers in two different ways. I could go, well, lots of different ways if you're in the community, but they could either come and visit me in a hospital setting. So I'd book a room in the team, where I worked at St Mary's. Obviously, it's quite a clinical setting. Some people didn't want to do that, and I would go out and visit people in their own homes. I would also meet people coffee shops, community centres, shopping centres, wherever they wanted to. But the key was what was ever best for them, what was easiest for them. That was how I did it. I also meet people online as well through Teams, because as a carer, it's sometimes difficult to get out of the house. It's sometimes difficult to meet. But equally, I was sometimes that only contact for somebody, and they would meet me at a coffee shop and we would have that time and that space. As I say, it's guided a lot by the service you're working with and where you are working. But yeah, lots of different settings, Joanne. Does that answer your question?
Yeah, that's lovely. Thank you. That's really helpful. Thank you.
You're very welcome.
So any other questions anyone's got?
Yeah.
Oh, go ahead, Joanne. We've got another question.
Yeah, I've got another question. I'm just thinking, from a governor point of view, then governors want to really find out what services are happening. So that's why we're, you know, listening to you. And I guess in a way, if there's any ideas in sort of a programme of engagement from the governors, how governors could maybe connect with the Recovery College. So I don't know whether you've had any visits from any governors, Sarah and Matthew, in the past.
I don't think we've had any visits from governors, but you'd be more than welcome to come along and meet the team. We're based in Campbell House, or join as a student and come along and experience the courses firsthand. It's, you know, that I think that would be the best way. Sign up. If you need help with that process, give us a call. We can do that, you know. But it'd be, yeah, really valuable, and maybe from coming along and actually experiencing it firsthand, you might actually find out, oh, this could be useful here, or I could find out, you know, tell a few more people about it here and such like.
Yeah, I think, yeah, that's great, because I think Tracy and Richard will probably have some more thoughts about that. So thank you, Matthew, because it's just absolutely fascinating. It's just, and Pete, to hear, you know, what the message I've picked up from you is it's transformed this chapter of your life, hasn't it?
Very much, Anne. Come along. Have a sit down. Come along to the co-production course or something like that, and just sit and drink it up.
Yeah,
you know, because you're just another one sitting on a chair there, and you'll thoroughly enjoy yourself.
Yeah, I'd love to come and join your humour course. I think I've got too much to do in the day job, though, to do that, but it would be fantastic. Thank you.
Richard?
You'd be very welcome.
Thanks very much. Like Joanne, I sort of blown away by some of the work that's going on here. I remember starting the journey, I think, with Anne and Paul, when recovery was a very new concept, and thinking about what does it mean, and doing some work with IMROC at the time. So it's great to see how the flower is now very much in bloom, which is fabulous. I guess I was a bit like Joanne, thinking, how can we help promote the work, generate the new ideas, as you were describing, Pete, for some of the courses. And I was struck really with a recent event that we did with our counterparts from Kettering General Hospital. So we had a session with the governors there. I'm conscious that many service users of NHFT also access KGH services. So I wonder, have you had any conversations with KGH, or indeed NGH, I guess, for that matter, about opportunities to collaborate on this sort of work? And could we help in doing some promotion via our colleagues at KGH for new students, or indeed new course ideas?
We definitely could. So I previously, before joining Recovery College, I worked for the Mental Health Liaison Service at the General, so for NHFT, but was with working with KGH and NGH colleagues, and we did some training there around mental health for the staff there. But since then, I've been in contact with one of the psychologists that we work with, who's interested in developing a course on delirium. And then, but what we'll say to our practitioner colleagues is, if we can both benefit. We can help you support, you know, with the administration of the course. We can pay for a venue. We can help advertise. We can put it on our prospectus, and that way, it can, the team that you're working with, so for example, if you're working with dementia and delirium services at the General Hospital, the folk you're working with and their families and carers and staff on those wards, they can come. But also, if it's on our prospectus, anybody that's on our mailing list, anybody that's enrolled as a student, they can come as well. So absolutely. We also work quite closely with colleagues from the Autism Champions Network. They've developed some absolutely first-class courses. Some have been put on hold because people have been between sort of posts, etc. But they're going to be coming back online for our summer term. And again, they're about being county-wide. They're doing a lot of in-reach stuff now. I think they've got an event at NGH coming up later this month, I think, as well. But yeah, I mean, what we don't want, Richard, is we don't want to. We're quite limited resource-wise, to be honest, and we don't want to overstretch ourselves to a point that we can't give students who need extra support and need a bit of a personal experience. We can't give them a decent experience. We can't make them feel valued or supported. That's what we don't want. But yeah, you know, we've got people that are staff at NGH, KGH who come along. They've enrolled. They come along and sort of spread the word. But yeah, I don't know about other sort of projects, but we're always open to it in the future.
That's great. Thank you.
David, you've got a question?
Yes, I mean, the most important thing is to thank you for the presentation and the enthusiasm, which is infectious and also very very positive, and says a lot about how NHFT approaches these things, because I guess it doesn't happen everywhere, does it? So this is good. I'm standing down as a governor, so I won't have the potential to carry on in some ways, but it occurred to me that something to explore might be something linked with co-production. I think governors might actually something specifically for governors in partnership with service users and others would be quite useful around what co-production means and how is NHFT doing it, and how can governors support that. Just a thought, Tracy and Richard, something which is would be topical and would be good for governors, because it engages us directly with service users and people, which I think, to be honest, many of us are frustrated that we don't have enough of, in a way. So that would be a good line. But thanks very much for the presentation. I'm sorry I've got to go because I'm doing something else this evening, but I wanted to express my appreciation. Thank you.
Thanks, David.
Thank you. Thanks, David. We've got a co-production course coming up on the 25th of March. I'm just putting the link in the chat. So there's spaces on that course. Again, you need to enroll as a student, but yeah, you'd be extremely welcome to come along to that. That's like co-production around sort of examples for mental health services predominantly, but it says that it's also a lot about individuals, about co-production in your individual care and treatment, your care plans and that sort of thing. But yeah, it'd be great. Spread the word. You'd be extremely welcome.
It's about the ethos of working alongside people in the community, which is a key issue, I think. And I mean, it's good to be mixed in with things, but it might be good for governors to have a group to do that, working with your people. And it might stretch you too far, but it just occurs to me it might be a creative thing to do. Thanks very much. Sorry, I've got to go, but it's been really good. Bye.
Thank you.
We've got a question in the chat box from Pat saying, is this for any people in Northampton? Now, I think you did say earlier it was county-wide, didn't you, Matthew? So could you just clarify that? Yeah,
so we are for people that, as we said on that the slide as Pete went through, with for people of Northamptonshire that predominantly access NHFT services, or staff members of, so current or former service users that access our services. So that's any service. So for example, if you're a carer and your son, daughter accesses children's services, you can definitely come along to the Recovery College adult courses. I know that, you know, we're going to have much more to offer as a trust as from CYP side, as the iDiscover Children and Young People's Recovery College equivalent gets underway. And I think we've got a presentation around that soon, haven't you, Tracy? Is that, or is that the next one or something?
Yeah, we've been looking to do something to help promote the iDiscover services, which you're correct is the children's equivalent to the Recovery College.
Yeah, so any services. So it's a resource reason why we can't just open our doors completely to every primary care, and that's everybody that works or lives in Northamptonshire, for the reasons that I said earlier. But we're pretty flexible. If we've got spaces on courses and people can benefit and their families and carers can benefit, then we'll support you to attend. It's as simple as that. And yes, it's for people of Northamptonshire, but you've got services that we work with that overlap into other counties as well. So there's a bit of flexibility. So Northamptonshire carers, I'm looking at Nicola a bit, some of the sports support for carers and young people, that's across counties and it's regional. So people that access that could access the Recovery College courses as well. So yeah, predominantly folk of Northamptonshire and those that access our services.
Nicola, have you got a question or comment?
No, I was just going to say, I mean, obviously I work at Northamptonshire Carers. I've come in because I'm interested in getting more involved with the Recovery College, but we do have two really good wellbeing two courses. One is about wellbeing, one is about just what it's like to be a carer. It covers a lot of we tick a lot of the same boxes, working with Matt and various people from the Recovery College about hope and control and reducing isolation and giving people opportunities. So yeah, as Matt said, we share those on our webpage as well, and anything that people can access from our services as well. So we're probably guilty of enabling you to spread a little further over those boundaries. But yeah, it's amazing. And I've put a couple of things in the chat. The co-production course I've done was amazing. I've worked in the health service and voluntary sector for like 30 plus years, but I thought I did things in a co-produced way. But actually, when I did the course with the Recovery College, I realised quite how I was paying lip service. And it's very powerful. It's worth doing.
I'm the same. I've just like Nicola, I learned a lot from, I was involved in the Recovery College before I joined the team, and I thought I was working co-productively, but I learned a lot from my peers about how there's room for growth and there's room to do things better. And yeah, I was doing co-production light, if you will. So I learned a lot from other folk, which is brilliant. It's all part of it.
Yeah. Can I ask the question, Matthew, the co-production course? Yeah. How so with the link that you've put in there, how long is the course? What does it involve? How long is it?
So it's 3 hours.
Yeah.
The one that I put the link into there, I'm just going into it on Eventbrite. That is, I think it's taking place in Northampton. I think it might be at let me just double check. So it's at the St Thomas Centre at Northampton Cathedral. So there's like a community centre on the back of behind the 1850 cafe behind there, which is a really lovely facility that is. Yeah, so it's taking place there 9:30 to 12:30. Yeah, it's 3 hours. I think Adam Smith and Sue Hoyle are the co-trainers for that one. But yeah, we've got spaces on it. You'd be extremely welcome.
And do you run that course frequently through the year? Do you?
Yeah.
You run it
that's
frequently, do you?
Yeah, that's repeated fairly often, that one, both online and face to face.
Oh,
north, south.
You do it online as well.
Do it online as well, yeah.
Yeah.
We're just getting the dates set up for courses for the summer term. So when we have got those all finalised, you'll see that there's a few more dates up until July.
Because if we're being in the NHS, and certainly NHFT is supporting the QSI course, yeah. But again, this type of everybody, because of the money that there is only limited amounts, it's all about transformation. So that type of course can be so useful in every situation, can't it? It would be, yeah.
And I work with a number of charities telling them and introducing them to co-creation and co-production.
Yeah.
And when they realise that there's a whole army of people with lived experience out there who can help them when they form a team,
exactly,
to show them, to take them by the hand, really, and lead them through that unexplored territory that actually we're scouting, because by the very virtue of the fact that we've got a diagnosis, so that we can help them to hit the right targets.
Exactly.
And to do it more cheaply as well.
Yeah.
Because we're consultants, but we're free.
And Pete, you'll see the gaps, won't you?
Absolutely, we can't help it. It's just
you see the gaps because you stumbled across them and it might have stopped you from going from
a
A
carer
to B.
sees the world through the prism of being a carer. Exactly. I see the world through the prism of dementia. I can't help it. It's not a skill. It's just something that is a natural product of the way that I live, that I can see the elephants in the room that other people might not spot. And once you grasp that, all of a sudden you understand the value of co-production. And the value for me, of course, is that it's keeping me out of the NHS sausage factory longer, because it's keeping me feeling fit and well and having a lot of self-worth. So everybody benefits from it.
Exactly. Well done. It's lovely to hear you.
I'd just say that Pete's involved in other things in the Recovery College as well, like our marketing group as well. And Pete's got a lot of knowledge of sort of IT and that sort of stuff that we just don't really get. And so we get a lot of education the other way as well.
You're getting from Pete, you're getting 5 for the price of 1, aren't you?
Too right,
You don't get that in the NHS. You don't get even 2 for the.
You do with Recovery College, because you get the emergent properties that come when a service user works with a service provider. As I say, both sides of that coin. We learn from each other. It's great. And of course, when you're a professional, and you're ploughing the same furrow day after day, it's very easy to be so deep into it that you don't have the opportunity to look outside every now and then and examine what you do. But when you're writing a course about something, you're examining what you do professionally, and that's just a breath of fresh air, isn't it, for all professionals?
I think Pete, it's depends how long you've been in the organisation. If you're quite new to the organisation, you see it in a different light to your colleagues who've been there for 20.
Yeah.
Do we have any other questions that anyone wants to ask? I've got one potentially for Sarah. I was just going to ask Sarah about the peer support, actually the roles, because there's a training, and then I thought if you could just explain a bit about if someone's interested in applying for a role after they've done either before or after they've done the training, how about they would go about doing that? Are they advertised? Maybe just explain.
They are advertised, and the roles are they're coming up all the time, and more often now once teams get to understand what the value of peer support work is. But one of the benefits you have if you do an IMROC course or you enlist on a training course is you also become part of our database, which allows us to send you out all of the vacancies that are coming up straight away from NHFT without you even having to go and look for them. We tell you all the posts that are becoming available before they actually go out onto, I don't know, Indeed or whatever the websites are, NHFT website and NHS website. So yeah, we let everybody know. And equally, whilst we're doing the course, I know what I do is I say there's a new post coming up and keep an eye out for it. So yeah, that's how. I mean, obviously, you can keep an eye out while you're training as well and before you're training, because the jobs are advertised far and wide, and the two kind of link up. There's no one before the other. I started, the way I did it was I applied for my post and I did my training. So I started both together at the same time. But that was quite a few years ago. What people are doing now is they apply for a job, and then once they are successfully interviewed, they are then added onto the training course. But you can do it the other way around. You can do the course without a job in place. And you know what, you learn things from the course as well without having a job to follow to afterwards. And there's a lot of information on the IMROC training course about what peer support is and the values that it has.
Thanks, Sarah. Nicola, did you want to come in?
Yeah, just following up on what Sarah said, I'd probably missed the first bit, sorry. So what would be the first step towards doing that then, if I wanted to do that?
If you wanted to do the IMROC course, wanted to do the training course for peer support, you would contact admin at NHFT. So I can put that into the chat box now for you, and that would be the first port. You can also contact IMROC directly, and they will put you onto the course. So it's one way or the other. It's whichever way is easiest for you. The one that we deliver through NHFT is geared towards NHFT. We'll add a lot of slides in there explaining and talking about recovery college and things like that. IMROC won't do that because their training is far and wide, if that makes sense. Ours is more specific to NHFT.
Thank you.
Tim, have you got a question?
No, I've literally just completed the IMROC training, and I found out Monday I've passed, and it is amazing. I've been doing peer support for Headway East Northants because I've got a brain injury, so I've been doing it for 4 or 5 years, and I've learned things that I didn't know, and it's sort of opened up a lot of new things for me. So it is something really worthwhile doing.
Thank you, Tim, for that. Your honest feedback on the course. Have we got any other questions? See, Sarah's put the email address in the chat. It's
Any other questions as well regarding training? I think Matt put my email address in earlier on. You can always give me a shout, and I'll help the best I can. Being an IMROC trainer as well, I'd like to think I know a little bit about the course. So if there's anything that you want to ask, please do.
Can I just say something from before my time with the Recovery College about when I was working clinically, and about how when peer support worker roles were coming out and how it was such a big change for a lot of clinical services, and there was a lot of resistance, a lot of concern, a lot of hesitation, a bit like, the blurring the boundaries between those that access services and those that provide services. But like Sarah, the team, and just hearing from like people like Tim and where it could be beneficial, it just shows you about the culture shift, doesn't it, in how we're thinking differently, doing things differently in NHFT now. There's improvements. There's more and more expert experience. We've got lived experience lead posts coming in anytime soon, with people joining like at a strategic level. But so it's amazing, and I think it's because of how brilliant the training is and the support is. Those teams will now tell you that they can't be without the peer support workers. When you say, Sarah, a lot of them, they'll just say, no way, we couldn't, how could we cope without it, sort of thing.
Absolutely, and I know from the other way around. So as I say, my daughter first became unwell around the age of 11, 12, we think. She's 27 now, 27 this year, and I would have given anything to have somebody support me in the way that we do. And I know that I've heard that so many times, not just to me, but to the other peer support workers that are working, that, obviously consultants, occupational therapists, CPNs, they're all psychologists, they all do fantastic roles, but peer support gives that little bit extra edge. It gives something else. And one of the things that we have found, we take our lived experience and we share that with the people we are supporting. But one of the huge things that we are used for is to be that link up, that go between services. And that's where we are unique. There is not another role that does that. People will come to us and they will say, can you ask the consultant this? Can you ask them, and there's no other role that does that. Is that advocate. And equally, I've attended meetings with parents about their child, and they have come away feeling so much more empowered. Peer support, I was lucky enough to go into a team that was really on board with peer support, and they helped me grow massively. There are other peer support workers that weren't so fortunate. They started peer support in their teams, and it was difficult, but it's not now. Everybody, I don't know a team that doesn't see the value of peer support, and even if they did, they'd be hard pushed to argue that against a carer or a service user, you know, that had received peer support.
Yeah. Can I just say I was very privileged to go to the award ceremony in when was it? It was November 2019 in Northampton for the awards. And I met a guy in the lift who was awarded an award. He came to the Recovery College. I can't remember his name. And I stayed overnight. And the next morning, I spoke to him and he shared his story with me. And I know that the Recovery College, I'm pretty certain that he participated. So, and for him, it was years for him to get his diagnosis from mental health because it was complicated. But I know that he was part of inputting then into the Recovery College. And so for me, listening to his story was so powerful. He had been a teacher in Peterborough. I live in Peterborough. So, you know, there was lots of local information that was just interesting to hear out of his story. Yeah.
Thanks, Joanne. As we're getting a bit nearer 6:30, is there any final words from any of our speakers, Matthew, Sarah, or indeed Pete? No?
Just thanks for the opportunity, and yeah. And it'd be great if this could be shared so other people can hear back on our services. Yeah, that'd be wonderful.
Yeah, we look forward to seeing some of you in a course or 2 or 3.
Yes, I will circulate the slides and some of the links to everybody, and the recording once it's ready, so you can circulate the recording, which will be on our website as well. But thank you for everybody who's come along today. It's certainly been enlightening, and I wonder if we can persuade some people to come to this comedy course, because I think that could be quite interesting. It sounds yeah, so I think we all think ourselves as budding comedians, but might be testing our limits, I think, there, some of us. But yes, it'll be certainly interesting. So thank you very much, everybody. Enjoy your evenings, and so we'll get the information back out to you. So thank you, everybody.
Thank you.
Thank you.
Thank you.
Thank you. Bye.